Well, July is Dry Eye Awareness Month, and we're at a specialized eye care place with Cross Keys, of course, with Dr. Brett Levinson and patient Carrie Levy. Dr. Levinson, thank you so much for joining us. We're talking about dry eye. This is a time of year where the heat complicates things, allergies, I'm sure. So tell us why people are dealing with this, more specifically this time of year.
Good morning, Tim. So dry eye is one of the leading causes that brings people to the eye doctor. All people say, I was told it's just dry eye. We would never say it's just a heart attack, just a stroke. Dry eye can be debilitating to people. They say my eyes are blurry, I can't work on the computer, I can't drive my truck, my eyes are red, burning, irritated. They may not say my eyes are dry, but they describe all these complaints that can really affect people's lives and their work.
Wow. So, Carrie, what kind of things are you experiencing? What types of things brought you to Dr. Levinson?
I was having severe headaches, and I had been to every doctor in town, neurology, ENTs, my primary care, my rheumatologist, and nobody could figure it out. And thankfully, Dr. Levinson diagnosed me with dry eyes, which is part of my autoimmune, and we have managed it for years now, and it has been life-changing.
And Tim, the same way you just can't lick chapped lips better, more lubrication for the eyes doesn't do the trick, because for many people, dry eye is an oil gland eyelid problem. And when you have inflammation in the body, these natural oils harden up like a milkmaid churning milk to butter. So for Carrie, we've done therapies to express these blocked oil glands. And people say, boy, my eyes feel better. I was constantly blinking and blurry. Now for Carrie, it was constant headaches. And she knows when her eyes are dry again, the headache's back.
So, Dr. Levinson, to that point, it's not just about putting drops in your eyes every 5 minutes. You have a new option for dry eye sufferers. Tell us about it, how it works.
Well, that's true. So we have the Optilift, one of our newer devices. And the Optilift is a device that helps to strengthen and tone the lower eyelid muscles. And we call this Pilates for the eye because it helps to strengthen and tone. And it takes 7 minutes per side, and it doesn't hurt. You feel a very mild pulsation and heat that helps to make these eyelid muscles stronger. By doing that, it makes the blink function better. The better we blink, the more tears that work. In our modern world, we blink less on the computer. And with time in the body, this muscle decreases in strength. Carrie, does that hurt at all?
No.
How does it feel?
Feels like just a little pricking sensation that doesn't hurt.
Right. And one of the nice things about this, we found out when we started this, it also improves the cosmetic appearance. So people say, you know, I'm bothered by the dark circles or puffiness of the lids. And even after one session, people start to say, boy, my eyes look better. In fact, Carrie sent me a text message after the first therapy. Do you remember what you said to me, Carrie?
I couldn't believe it. I looked like I had concealer on, and I didn't. My bottom lids were just so much flatter, and I just looked better.
Oh,
so
boy.
We've been very happy, Tim, with this procedure because we can do in the office a 14-minute procedure. We recommend 4 rounds about every week or 2, and then we recommend 2 sessions twice a year, every 6 months, to maintain this.
Okay.
Afterwards, we express the oil glands of the lids, and we recommend the at-home therapy the same way when you get your teeth cleaned, you still have to brush and floss.
Right.
Recommending hot compresses with omega-3 pills at home to keep this going.
Okay, so doctor, how do folks find out more information if they're interested in that therapy?
They can always go to our website, which is specializedeyecare.com, or call our office, and we're happy to talk to people about the whole range of things we have that's more than just over-the-counter eye drops.
Dr. Levinson and Carrie down at Specialized Eye Care in Cross Keys, thank you so much for joining us. Thank you for sharing the new procedure.
Thanks, Tim.
All right.